Hello, we are medical doctors from Center in Research and Training in Neurosurgery from Hospital Universitario La Samaritana in Bogotá, Colombia. Today we are going to present to you the abstract entitled Minimally Invasive Posterior Cervical Foraminotomy, Surgical Technique and Experience with Patients at Hospital Universitario de La Samaritana. My name is María José Pachón and I am going to be the presenting author. Conventional posterior cervical foraminotomy is a surgical technique developed to treat cervical radiculopathy. Minimally invasive techniques have been described to achieve better surgical outcomes. The objective of this article is to review the anatomy and surgical technique needed for a minimally invasive posterior foraminotomy. The indications for this procedure are foraminal disc herniations, foraminal stenosis due to facet hypertrophy, persistent symptoms after anterior discectomy, or contraindications for an anterior approach such as infections, tracheostomy, or radiation in the anterior portions of the neck. So as we can see in this slide, there are different advantages of the procedure, such as avoiding dysphagia, avoiding cervical hematomas and recurrent laryngeal nerve palsy. Because it does not require fusion, the patient will not present failed spinal fusion. Also, the segments that underwent surgery preserve mobility, and they have less tendency to present degenerative disease in adjacent levels. Also, another advantage is that you can have direct visualization of the compressed spinal root, and this means that you can confirm that the decompression was done. This is a retrospective study involving a series of patients who presented symptoms of cervical radiculopathy at Hospital Universitario de la Samaritana, where they underwent a minimally invasive posterior cervical foraminotomy. So here we have a case review. We have a 56-year-old patient who presented with a history of 6 months of cervical radiculopathy at levels C5 and C6 with no neurological deficit. We have here the MRI. The first one is a sagittal cut in which we can see a disc extrusion, which we confirmed in the axial cut. Here in the red arrow, we can see how the disc extrudes into the left foramen of the patient, which was probably what was causing the symptoms. The patient mentioned before was considered a candidate for minimally invasive posterior foraminotomy. Here we can see the patient position in prone with some head flexion. Then, after positioning the patient, we can see that the incision that was going to be made is going to be 2 centimeters paramedian to the median line, and then we can see how fluoroscopic identification of the levels that are going to be intervened is done. So this is a video of the procedure. Here we can see after the incision how the dilators are being placed from the minimal diameter to the maximum diameter. The function of the dilators is to split the muscles and generate less injury in the patient. So as we can see here, after placing the self-static retractor, the goal is to ID these structures: the inferior facet of the superior vertebra, the superior facet of the inferior vertebra, the lamina, and the joint capsule. The green triangle is our work space. In this slide, we can see post-op images of a decompression C7, C8 in a sagittal cut and in an axial cut with a complete facet resection. We can see intraoperative images in which the white arrow is going to show us an easy visualization of the spinal root. The results were that minimally invasive posterior cervical foraminotomy is safe and has a lower complication rates and shorter hospital stays when compared to open and anterior approaches. The conclusions were that selection of surgical techniques for decompression of cervical nerve roots should be based on providing both safety and efficacy. With this procedure, there is less risk compared to an anterior approach. Minimally invasive posterior cervical foraminotomy is an excellent alternative for patients presenting with cervical radiculopathy due to its lower rate of complications and shorter hospital stays. These are our references. Thank you.